So the first unmet need, of course, is therapeutical approaches because as you said, for heterogeneity and for the rarity, the backbone for the therapy approaches based on the diffuse large B-cell lymphoma. Maybe it was the first mistake to extrapolate these types of kind of treatment to T-cell lymphomas. However, the first unmet need is first-line approaches. Then, of course, we still have a lot of debates on consolidation therapy with autologous stem cell transplant in the first line. And, of course, the biggest problem is these types of lymphomas, they are so aggressive. And unfortunately, the second-line therapies, the third-line therapies, they still didn't give us quite high response rates, and these patients, they progressed, and even if today we have quite a lot of studies with quite a lot of new agents, but however, previously, we tried to combine different targeted approaches with standard chemotherapeutical approaches, also intensify the first-line therapy to avoid the possibility of disease progression in the future or refractoriness of disease, but unfortunately quite a lot of studies were failed. So, and of course, we have to create, based also on our data, I think it's another one unmet need, some kind of PET-guided approaches to follow treatment strategies, to have a possibility, you know, to have to understand which patient will progress, which patient maybe doesn't have such high risk for the possible disease progression. Because unfortunately, in the routine clinical practice, quite a lot of patients with peripheral T-cell lymphomas, they will never achieve a response rate, and they will never and they will not be able to arrive till the 6th cycle of the first-line therapy. So maybe also future studies on interim PET are needed to understand how to catch these high-risk group patients and maybe to proceed directly with transplantation, or maybe to add another treatment strategy. So there are quite a lot of hypotheses about peripheral T-cell lymphomas. However, there is still quite a lot of work to do.